refreshing lunch and a chance to network with friends, colleagues. My name is John Yap. Is this on?
No, it's really quiet.
Oh, is this higher up? Do this. Where? You do
A
it.
little bit down. Just gonna get it above the collar.
Thank you.
I gotta have my moment of power.
Yeah, I
here.
know. Usually my wife does this. Okay, that's much better. Grab the door again if you can. My name is John Yap. My talk is on measurements, and I realized that I did not give myself nearly enough time. So I have 35 slides, and I'm going to do it hopefully in 25 minutes. But a lot of this is here on the PowerPoint, which you are going to get. It'll be on the website. I think I've put enough details in it to make it hopefully intuitive and obvious. And the most important thing is if you are logged into your server, you'll want to sing along with me when I get to the live demo part, okay? So I call this talk How to Tame Your Measurement Dragon. And thank you, Joelle, for getting me some of these non-copyrighted backgrounds. So fear not, hopefully you'll have this tamed by the end of the 25 minutes. So a few disclosures. I'm a GP, not a programmer. I use well in classic view. My servers are on site. I pay dues even though I am also the president of OSCARBC. I am the current volunteer president. I teach medical students. I heavily use Grease Monkey. So unfortunately, you don't get to hear about some of the wonderful Grease Monkey things that Dr. Hurwitz is doing. So the original Cheatesson Measurements was done by Herbert Chang, who is probably in the other talk. And it's hosted here, but it's a little in-depth. So what this will do is hopefully allow you to create some useful measurements, if you don't have them already, how to edit them and make them better to serve your needs. It does not cover such things as incorporating measurements into e-forms, linking measurements, also known as mapping. It's a bit of a dark art. I would say if you have a vendor, you ask them to kindly do that for you. You pay them enough to help you, and that's another thing I think they ought to do. So if you're able to log into your server, please do so now. So why measure? You've already heard that this is a fancy database, this whole EMR thing. Everything we put into digital format can be called upon. And the more granular you make it, the more distinct you make it, the more you have to work with. But you have to have good data, because you've heard garbage in is also garbage out. Even your notes are measurements, very free-form measurements, mind you. So, you know, there are a couple of things I noticed, because I also do teaching of physicians in clinics who need EMR help. I noticed that in their measurement groups, there was like a couple vital signs. Urinalysis as a measurement group. You know, if they have vital signs with BP, they're lucky. Some of them don't have pulse, which is mind-blowing. Okay, so use measurements, and if you haven't used them properly, this will make it hopefully easier. If a task is easy to do, you'll do it. If it's profitable, you're more likely to do it. If it's not easy, it's going to be ignored. I supported a clinic for 10 years. They put blood pressures into their chart notes, never once into measurements. So none of their flow sheets populate with any blood pressures. And I don't know if HDC is in here. They would find that horrible to work with. So measurements are basically associating numbers with a physical quantity phenomena. In OSCAR is capturing some data set with a specific time that was observed. And the measurement consists of 4 unique elements, I'll call them. There's that ID, which I think David hinted at, was limited to 4 characters only. Imagine all the hepatitis serology that you have to capture in 4 characters or less. Not doable. It's been expanded recently, at least in the WELL system. I don't know if other flavors of OSCAR allow for that. There's a description, a display name, and some instructions, and a validation. And all these will become pretty obvious once you see the later slides. So you can get into measurements and see the entire list of them all through administration, system management, and then customized measurement. I think that's pretty standard across most OSCAR setups now. In mine, it's, I need my glasses. It's alphabetical. In yours, it might be alphabetical by type, and mine is by display name. So you might see slightly different presentations. There are some good things and some bad things. This is my measurement for allergies. You can create your own. So for allergy shots, you know, vial 1, vial 2, you can put in the data. The nice thing is you can create a report out of all of this. You can print it, you can submit that back to your allergist, okay? The not so nice thing is blood pressure. I have a single blood pressure measurement. Who has 4 measurements? 4 options. Blood pressure sitting, standing, supine, BP true. Oh, I don't see any hands up. That's great. Oh, I see one. So it's always the one that you don't want, of course, right? You can eliminate some of that. Down below at the bottom here is O2 sat and O2. They're both the same thing. And if you look very closely, the O is not the letter O, it's the number 0. So somebody didn't take chemistry, unfortunately, but that no longer can be changed. So that's some of the weird things. So this is where things get confusing. If you go to a measurement area, you'll see the type. That's the display name. You'll see the measurement instructions, okay? And sometimes there's way too much information there. There's the value, which needs to be in a certain format. If it's words, you can't graph a word. If it's a number, yes, you can. And you can limit it. There are certain formats like blood pressure or dates and such. And then the comments. And in earlier versions of OSCAR, comments would not allow certain characters. Special characters are using coding, such as brackets, less than, greater than signs, I think, and apostrophes and quotation marks. Everything else is probably good to go. If it's a number, you can graph it here. I showed an example of a graph. And the instructions, as you can see, it's in milliliters for that vial and so on and so forth. Okay. So this is where, you know, oxygen saturation gave me issues. One has percent and one has nothing to kind of guide you. And that's important because, you know, it's an order of magnitude of 100 if you use a 0.01 versus a 1%. Why are 2 options available? It's because the name oxygen saturation is in there identical, whereas the ID is different. One says O2, one says O2SA, or 0. So you can see that below. Okay. So when you create a measurement, who's created a measurement here? Because there are many E-forms that don't have measurements that do need them. If you have an E-form and you try and save it and it doesn't save, you get a little red warning, this measurement doesn't exist. That's why. You can print it, but it won't submit or save until you create the measurement. It's not that difficult. Just follow these few simple rules. So if you are logged in, go to Admin, System Management, and find Customize Measurements. Okay, and we're going to go into the top area, which is Customizing Measurements. And we're going to add a measurement. So that means you're going to give it a type name. That's that unique ID. You might be limited to 4 characters, and it cannot already exist because it'll give you a validation error. This type already exists. So you can't create another blood pressure one, even though there may be 4 of them in there already, because they were force-fed into the system. Then the type description is yet something different. It's not a type. You can be a little more wordy. I would maybe caution you against using too many fancy symbols and characters because you might find out the hard way it doesn't work. The display name, oftentimes they're all one and the same. Weight, 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 or A1C, A1C, A1C. Measurement instructions. Just know that whatever you put in here or whatever already is in there gets pasted into your chart note. So if it tells you you should measure in this format every 3 months, that's going to be in your chart note every time. So that's ugly. And it took me a while to get the courage to actually, you know, change that. And you can, and we'll do that. Okay. If you don't like the type name, once you create it, you're going to have to call your OSP for help to extricate it. I don't know of an easy way or any way to delete it without your OSP to help you. Everything else is subject to your customization, okay? So I hope you have this, because before OSCAR 19, there was no easy way to edit a measurement. If you didn't like the validation rules, the measurement instructions and such, you had to delete the darn thing. Don't worry, if you delete it, all the information that was previously saved is still there. You can't see it though, or you can't add to it again until you recreate that measurement with the exact ID that it was before. So you have to know what that is. And sometimes it's not intuitive or what you'd expect it to be. So make a new measurement to get it right the first time, because there can be a second time, but you have to ask for help. So you select a type. If you click Edit Measurement, you get to this page. Now, has anybody navigated here? No? Okay. This wasn't there in OSCAR 15, and it's made a huge difference, because now you don't have to delete that measurement. You have to find the one you want to change, then make the change, okay? And so if you click down, select type, for example, I wanted to find pulse. Well, pulse is not P. Pulse is HR for heart rate. P gives you para for obstetrical work. So it's not always intuitive, because we only had so many characters, and some of them are redundant. Okay. If you want to find out if the measurement exists, click on this View All Measurements. You'll get a complete list in whatever order yours is set to. Use Control F or Command F to find a keyword, and hopefully you'll find it. I found that there's 2 oxygen saturations. I also found one that was redundant. I can't show you the blood pressure example. I found albumin. Okay, 2 albumins, don't know why. So deleting measurement types, yes, you can do so. The data that you saved already remains there. You will still see it if you go to that patient who's had that measurement. You just can't add again to it, because you need to have it displayed, and it won't display until you recreate it. So measurement groups. If it's easy, you'll do it. Where do you add blood pressure if you don't have blood pressure in an easy to find group? It's in CDM indicators, okay? What's not in CDM indicators? Pulse. How do they miss that? So I don't use that. But if you create a disease registry with something that has hypertension as relevant, that will show up in your flow sheet, and you can get to it that way. But why not just create a vital sign measurement group? Okay, so that's what I have. I have obstetrics one, serology, a big vital signs one, and my partners didn't want 20 items, so I trimmed it down to a short list. How do you create a measurement group? From here. I have one called allergy. You can modify what's in there. You can create your own. You have to back step. Where is it? I'll get to it in a second in the live. You can create a new one. Again, make a title that's relevant, easy to remember, and add what you want, not too much. You'll see why in a second. Oh, here, add measurement group instead of edit measurement group. So there you go. Give it a name. My measurement groups include allergy, OBGYN, serology, and so on and so forth. There was a special one I had to make for COVID. The first one you create goes to the top. The last one you create goes to the bottom. I don't know what that second bar does where it says select style sheet. It always comes up blank. So you can also, jumped ahead. Change the order in which your items show in your group. It was always alphabetical, so it wasn't so bad, BP at the top and weight at the bottom. And then it got changed. It became like first in, last out sort of thing. You can change it in this, if you have this feature, sort measurements alphabetically, or last one in is at the bottom. And then you can organize it in a manner that seems logical, like blood pressure, pulse, weight, then height, and then maybe BMI and so on. Just remember, if you delete any one from anywhere on the list, if you add it back, it's at the bottom now. So plan ahead. So how do we use this at point of care? This patient's here for a blood pressure check. You can type in the blood pressure there, or you can go to vital signs. I click there, vital signs, okay, and then I add blood pressure there, add a comment, making sure there's no special characters. Mine only says sitting or average because I have one of these automated blood pressure cuffs. And when I hit save at the bottom, I added this. It goes into the chart. Sorry, I think it's in the later slide. This shows the previous readings from April and February and that. And because it's numerical, you can graph it. Other things like A1Cs is a little more dramatic. You can see how things change based on when they start a certain medication. So there's the example. If you type in measurements and you save it, it shows up just like that, sitting or average. And if you have a whole bunch of extra text that you don't want, that's when you have to edit that measurement. Can you still hear me okay? I'm moving around a bit, and sometimes I hear myself and sometimes I don't. All right. What happens if you put an erroneous measurement? Like this 152 centimeter is definitely off because everything else is in the 170. You can delete a measurement, okay? So you check the box in the far right, highlight it, and you can delete it, and it disappears. This happens if somebody puts in a measurement that should be kilos and it's in pounds and such. You get some weird BMI results if you don't put in the right format. Any questions? Nope? Okay, carry on. I want to show you live how this works. So here's Johnny Rotund. And this has got a lot of grease monkey in there. Most people go to measurements and just hover over measurements, and then hover over way down here, vital signs. And you can see I have like 20 items. But blood pressure and heart rate are next door, which is great. And I could add whatever I wanted. And maybe this is a standing blood pressure, pulse of there. And of course, you want to indicate if it's regular or irregular, and you submit it. And so it may not fall into the right location for your note, but you can copy and paste and just reposition it somewhere else. All right? Okay, now, how do you check all your measurements? Here they are. So hopefully you all have all the basic ones, but there's some that we're sorely missing, like the mental health ones, PHQ-9, MDQ, all the child and youth mental health ones, the CAD score, and so on and so forth. With COPD, they're now using MRC values to calculate roughly, how aggressive you need to be to treat your patients and such. So I found that albumin is in there twice. There's albumin in grams per liter, albumin in grams per liter with a range. And that's going to show up in your chart every time. And that's not very helpful. Albumin, I believe, will actually auto-populate from the labs that you order, which is great. Many of those things do. It's not part of this talk, but that's mapping. Fortunately, when it does that, it doesn't go into your chart. It's when you manually add it that all the extra bits go into your chart. So what I'm going to do now is I'm going to add albumin to my measurement group. So that's here. I'm going to edit my measurement group. I'm going to put it into vital signs. And I'm going to modify. So on the left, yes, on the left are all the measurement types. And on the right are the ones that I've added. And you can see there's a little bit of method to this madness: blood pressure, heart rate, temperature, and at the very bottom, alcohol. So I'm going to add albumin. So where is albumin? Well, I'm hoping it's under A. This is not alphabetical. It's rather random, but I'll give you a hint. If you type the letter A, it goes through all the A's in sequence. So somewhere in here, I hopefully will find albumin. There's albumin. So I'll add it, and it jumps from the left side to the right side over here. If I go back to Johnny's measurement under vital signs now has albumin in grams per liter. So if his measurement was, say, 65, I'll add it like that. And now it says albumin, 65 grams, range 35 to 50. That's not as obnoxious as many others, right? The ones with all the NNNs and all that. So what if I don't want that in there? What if I just want grams per liter? Skip the range and let's leave it at that. I have to edit this measurement now. So let's go to edit the measurement. So now you have to search for albumin, and the same idea, just keep clicking A until you find albumin. And there's probably going to be two of them. There they are, 1 and 2. So the first one says in grams per liter. How about just grams per liter? How about I just get rid of one of them? They both have the same ALB. You can do that with blood pressure. You can do that with all 4 of them, or 5 of them, or however many you have. Just remember to recreate it, okay? Maybe just leave the one good one, the one that suits your needs the most. So maybe I'll just back step 1, and we'll go back to our list and find albumin, which should be here and here. Which one's the most obnoxious one? How about the one with the range? I'm going to check that one, double and triple check. Go to the very, very, very bottom, and it says delete. Delete. You may be able to delete multiples, like 3 out of your 4 blood pressures, or you can play it safe and delete 1 at a time. So when you do that, something very interesting and annoying happens. It's gone. Like both of them are gone, I think, from your measurements. Sorry, I need to find, actually, this is the easier way, vital signs right here. This is grease monkey. So there's no more albumin here. They both disappeared because I deleted from that original list. It's just one of the quirks. So if you do this in the right sequence, it'll minimize your frustration. It's going to be frustrating nonetheless. I want to edit the other one, though. So click A until I find one of them, this one. And I don't need in grams per liter. How many people have weight in kilo? Get rid of the in. Celsius, I believe, is spelled wrong. It's one of my OCD traits. I don't like misspelling. Grams per liter. How about that? And this is the range. You do not expect it to go over 300. Some measurements are integers, like 1, 2, 3, and 4. Some are just numbers greater than 0. If you ever wonder why your PSA graphs disappear, is they decide to put a less than sign into some field that needs to only be a number. So they've broken it for you. Thank you, Accelerus or Life Labs. Anyways, I'm going to change it to that, and it says successful. Yay. It's still not in my group. I'll put it in there now. Oops, here. So you do need to retrace your steps multiple times, but I think once you get it right, it's going to be easier to do, and if it's easy to do, you're more likely to do it. I'm hoping it's this one. So we'll just refresh this. There's albumin. It's in there once, and now if I say 76 now, it's going up. It looks a lot better. Albumin, 76 grams per liter. 5 more minutes. That's pretty much what I want to demonstrate. You can create a measurement. You can add to it. You can, clean up your measurements, and you should use them. Remember to go to measurements first, and then when you hit submit, it will save into your chart. Position it where you like it to be so that it makes sense. Some people make entire soap notes out of measurements. Some people write entire consults using measurements. So it's really helpful and really important. Questions? Yes?
So we have multiple measurements of the same type, delete one of them.
there will be an error message, usually the top left corner, often in red, says this measurement does not exist. It'll even tell you what the measurement is.
So there's no way of predicting, say I have two albumins, I want to delete number 2, but it ends up being the one that's associated with my form.
No. The ID number, the $$ name, is that ID, that type, that first type, not type description, but just type. It should have been named something else, like ID. And that's unique. And normally you couldn't recreate another albumin. I could try it now and it'll say, sorry, it already exists. So you won't have a problem with that issue, as long as that albumin, ALB, is there. The description name, full name albumin, it could be ALB, it could be lowercase LB, you can do what really is. Your question? Okay, great. Any other questions? Yes.
You didn't touch on the validation path. Was there something that you find useful?
The validation is critical. There are certain things. Fit test came as a number at one time, and then became positive or negative. Well, it wouldn't accept if you wanted to manually add positive and negative because it wanted a number. So I had to change that validation. That's the most obvious thing. There are certain things like serology will come back as non-reactive or might give you an actual titer, a number. When it comes from the lab, though, OSCAR will accept it, no matter what the format is. So that's why the less than will show up in the PSA value. And yet, when you try and add less than yourself, it will not accept it, okay? So the lab doesn't know this or don't care to address it, unfortunately. It's very frustrating. We can't do anything about it. OSCAR is set up to do certain things, and it expects certain things. And they go play wild and crazy with how they want to send us the information. So that's one of the things that you might find if you're trying to graph something and it just doesn't graph and you know it should, or it did at one time, like GFR. They'll put a comment in the value section, the number value section, I'll say. Any other questions? Well, I'm only a minute over, so that's great. Thank you. If any more questions, ask me later. Thank you.